Dr. Vikki Petersen here. I'm founder of Health Now Medical Center and co-author of the book, The Gluten Effect. Today's question comes from a reader that asks about correlation with celiac disease. She's a celiac, and because she is, her medical doctor on her recent physical checked her vitamin D levels and found them to be quite subpar. And she's a good celiac, meaning she's sticking to her gluten-free diet, and she's wondering what's happening with her vitamin D levels. She also mentions that her doctor said to her that he is seeing a lot more of deficient vitamin D levels, and her overall question is, why is that? Why are we seeing a lot more deficiency of vitamin D, and why is her vitamin D level not coming up to normal despite her good diet? First of all, we get vitamin D from the sun, and as you know, sunscreen protection is something that has been really pushed the last decade, so more and more of us are using sunscreen, so we're not getting that sun to penetrate our skin, and so we're not being able to make vitamin D from that. The farther away you live from the equator, the more likely you're going to be vitamin D deficient, and the more you use sunscreen, more likely as well to not be producing vitamin D. Then you add to that having celiac disease or gluten sensitivity, and the vitamin D that you do get from your diet is not being absorbed properly. Even if you're augmenting vitamin D, if you're not able to absorb it, then of course it's not going to be able to be utilized in your body. So if you are a celiac or you're gluten sensitive and you've been off gluten for quite a while, meaning over a year, and your vitamin D levels are not coming up, I would be suspicious that either some gluten is getting into your system or there's some other factor that's preventing you from really restoring the function of your small intestine. Remember, the lining of that small intestine looks like shag carpeting. You have these finger-like projections called villi, and it's from the tips of these villi that you're able to absorb the fat-soluble vitamins like vitamin D. So very early on, when gluten is having its effects and you're starting to lose the tips of those villi, very early on we start to see these fat-soluble vitamins like vitamin D get compromised. So when you're starting to regrow those villi, they have to completely regrow to be able to start absorbing again at a proper level, which should be able to be achieved in several months, up to a year. And if that's not occurred, you want to look at why. One thing we talk about in our book, The Gluten Effect, is secondary infections. There can be parasites, amoebas, bacteria that are actually continuing to cause the destruction of the lining of the small intestine, and until those are eradicated, you're not going to get that complete healing. Also, sometimes there's so much irritation from the gluten that the body needs some nutrients to really take down that inflammation enough to heal itself. Obviously, the older the body is, the longer this healing needs to occur, and the longer time it takes to occur. And then as far as supplementation, it's very important that you supplement with enough vitamin D. Sometimes the levels are not coming up because we're taking something that's kind of a good basic multiple, maybe it has 800 units, international units of vitamin D, and we think that should be enough. What we're learning is for every 10 points you want your vitamin D level to come up, you need 2,000 international units per every 10 points. So if you came out with 20 or less, as an example, I'd like to see you at 50 when you take a blood test. I'd like to see that vitamin D level at 50. That's very protective of not only your bones, but it's protective against cancer. So that's a very good, strong level. So if you were in your teens when you got your blood test back, we're talking about 30 plus points that you want to bring it up. That would be 6,000 international units plus per day. We here at the clinic, when a patient has a very low vitamin D level, we'll give them a large dose for a very short period of time just to get it in their system and to start rolling, and that can make a big difference. So very often we're just not supplementing enough to really get those levels up there. So few different points you want to look at, but don't ignore it. Don't ignore a low vitamin D. It's very, very important that you get that level up, and it's certainly not difficult if you look at all the possible factors. So I hope this helps, and until next time, to your good health.